Hi, my name is Dr. Angela Weyand, and I'm a pediatric hematologist at the University of Michigan Medical School in Ann Arbor, Michigan. I also was privileged to be a guideline panel member on the recent collaborative effort between ASH, ISTH, NHF, and WFH on the diagnosis and management of von Willebrand's disease. And I'm excited to tell you a little bit about one of the specific recommendations that the management panel, which I was a part of, ended up deciding on. And that specific recommendation is for the treatment of heavy menstrual bleeding in patients with von Willebrand's disease. We know that heavy menstrual bleeding is a very common complaint in patients with von Willebrand's disease who menstruate. So I think this is a really important question to tackle. The recommendation on how to treat heavy menstrual bleeding in these patients was twofold, acknowledging that there are some patients with heavy menstrual bleeding that are not interested in currently becoming pregnant, and then another group of patients that are more interested in becoming pregnant. And both of these patient groups are equally important in terms of the importance of treating their heavy menstrual bleeding, but may require the use of different options. So the first part of the recommendation specifically addresses patients that are not currently interested in conceiving. And the recommendation is that for patients with heavy menstrual bleeding, the use of hormonal contraception, whether that be an oral contraceptive pill or an intrauterine device, should be used, or an antifibrinolytic such as Lyseta or tranexamic acid should be used over DDAVP. The second part of the recommendation specifically addresses patients who are currently looking to conceive, who obviously hormonal contraception is not going to be a good option for those patients as it will prevent pregnancy. In those patients, our panel ultimately decided that the use of an antifibrinolytic such as tranexamic acid would be preferred over the uses of DDAVP. Specifically, this question I think is so important for the guideline panel to tackle. As someone who treats a lot of young women with heavy menstrual bleeding, it can have so many adverse effects on things like quality of life, but also a lot of downstream medical effects like iron deficiency and anemia. So it's really important that we treat these patients appropriately. When we are coming together as a guideline panel, we evaluated all of the literature, and there aren't as good of a studies as we would like, but what we ended up doing was reviewing all of the data that we do have to see which of these would be most effective, and then also really discussed as a group, both with patients and physicians, everybody who commonly sees this, and discuss kind of the adverse effects of the various treatments, as well as kind of the benefits of those various treatments in coming to this recommendation. So I'm really proud that I got to be a member of the panel. I think it's super important to treat heavy menstrual bleeding in these patients. And hopefully, these guidelines will spur people to talk more about this and also hopefully do further research to identify even better treatments. And I'm really excited to be a part of the effort to disseminate these guidelines further, as I think this is so important for the von Willebrand's community, but even the larger medical community to be aware of as well. Thanks so much.